And just to confirm, we have one ICU nurse who is on the left-hand side towards the ventilator at the chest level. That's the correct positioning. Team, we are going to prone this patient. It has already been confirmed that they need proning. We are the proning team. We just need to check a couple of things. The first one, main contraindications. One, the patient is not pregnant. No, it's a man. Two, they do not have an open abdomen. Could someone check they do not have a laparostomy or open abdomen? That's fine. None. Cool. And they are not cardiovascularly completely unstable. Okay, they're not cardiovascularly completely unstable. So we are going to do a full prone. The steps are, first of all, I will check the airway and tubing. Could you confirm we have 2 sheets, 4 pillows, a head ring, eye tape, and 6 ECG dots, please. And let's bring them across, put them at the bottom of the bed. So first of all, could we remove the ECG dots from the patient? Yep. So we now need to make sure all the lines are secure, and the way we secure them is the fluid lines. They go parallel to the patient, either down to the bottom at the feet or up to the bottom at the head. This is long enough, and it's secure. The patient does not have a chest drain, does not have a urinary catheter in, the bag would go beneath the legs, and does not have any abdominal drains in either. This is secure as well.
This is also the moment to go through and ensure that you stop the NG feed and aspirate the NG tube currently.
Just before we start, I'm going to check if the patient has been paralyzed. They have just been given 1 milligram per kilogram of rocuronium, so we can be happy that the patient is completely paralyzed. We now need to take off the patient's gown completely.
The purpose of removing the gown completely is to remove any possible kink in any material that will also cause a pressure area or a pressure sore. Remember, the time period for proning will be 12 to 16 hours, therefore the attention to all pressure areas is crucial.
Now, could we put a sheet above the patient, one of the sheets? And the most important thing of the sheet is that they should be 0 wrinkles, because that could cause pressure sores. And not covering the head, of course. So could we smooth it all out? Make sure that the lines are all visible at the end. In this case, there's nothing at the feet, so we've just got the line at the end.
Prior to proning, to facilitate good manual handling, we're going to insert a sliding sheet underneath the patient. So the easiest way to do this is on one side of the patient, prepare the sheet that is underneath the patient, hand it over to the opposite side of the bed, and when the doctor at the airway is happy, the command to roll will be carried out and a sliding sheet will be placed beneath the patient, in between the sheet and the bed.
Is everyone happy with the sliding sheet? When I say roll, we will roll to the lateral position. Not completely, but mostly. Ready, steady, roll. Are you guys happy? Okay, we're going to roll back, ready, steady, roll. And the same thing now on the other side. Everyone ready? Ready, steady, roll. And ready, steady, roll back. Well done, everyone.
Excellent.
If this is completely smooth, we now need 4 pillows, one over the chest, 2 over the pelvis, though we could also put a 1 if the patient's quite small. So this is over the pelvis, not the stomach, and 1 over the shins. If everyone's happy with this, they are placed centrally, could we now put another sheet on top of the patient, please? Brilliant. The length of this is quite long, and it's falling over the edge of the bed, so that's fine. We are now going to create a Cornish pasty. Does everyone know what a Cornish pasty is? We are going to roll, so all 3 people on each side.
So all 3 sheets incorporated into the Cornish pasty. Nice and tight.
Open them all. And then we do all 3 sheets. We are going to rotate the patient away from the ventilator. We are going to rotate the patient away from the ventilator, and the way we will do that is the people on my left will pull, get their hands underneath, pull, and put your hands underneath the Cornish pasty thing, and we'll lateralize the patient. Then you switch position. So you stay where you are, but the people on the left reach underneath and grab what these guys were holding on, and the people on the right reach over and grab that. And we do that slowly and in a stepwise fashion. So we will do it on roll, and we will stay in the lateral position. Step 2 will be switching hands, and then we'll roll them completely. Okay. Everyone ready? Ready, steady, roll. Perfect. Now, slowly switch positions. Now, we should have done this before, move them to the side of the bed, but they're pretty central. Now we're going to slowly just roll them down onto the thing. When I say roll, ready, steady, roll. Well done, everyone. Perfect. At which point, I now get a head ring. And we put a head ring. Thank you very much. Taping their eyes.
This is essential because this will avoid any swelling and edema of the eyes, the face. This patient will then not develop any pressure areas.
Could we now put the ECG dots, the 6 ECG dots on the patient's chair? Before we do that, if we take the top sheet off, and let's have a look that the pillows and everything have stayed in the correct position, which are centrally on the patient. And if we straighten the patient's legs as well. Is everyone happy with the positioning?
Final area of positioning is to avoid a brachial plexus injury and to place the patient into the swimmer's position. The arm with which the face is facing remains down, and at the back of the head, that arm comes up with a rotation that is anatomical, avoids dislocating the shoulder, and lays almost in a recovery position.
Now, we'll assume we have done that because the mannequin does not work. Could we put the 6 ECG dots on, please, in the correct place? Where does the 6th one go?
No, it's 5.
Five.
It's 5.
Sure, so 5 or 6 would be fine,
Five,
as long as you've got right and left, and then you have an element of left, middle, central and neutral, the same as you would do on the abdomen.
Cool.
This is now the time at which you will review any lung protective ventilation, wean the oxygen as allowed, and in some instances we may well find a dramatic increase in the tidal volume and also a dramatic increase in the oxygenation, and in some individuals there will be a really rapid benefit to the proning process. The patient will remain in this position for 12 to 16 hours. Ideally, proning is done towards the end of the working day, 5 or 6 p.m, so that the patient does not require deproning or to be placed in a supine position overnight. However, every 4 hours, the patient's head position will be rotated to avoid any pressure sores. Each rotation of the head will require an airway trained doctor at the head end to facilitate that, but it does not require the full proning team.
Hello everyone, we're the proning team again. We have an ICU nurse with us and the rest of our team. We're going to turn this patient back supine because it's been about 14 hours since we last proned him. We've checked that there's no other contraindications, he's cardiovascularly stable. I'm going to now put him on, could we take the sheets off and take all the ECG dots and anything else on his back off? Could we make sure all the lines are now parallel to the body again? So our monitoring lines will be coming up at the top, as well as the fluid line. He does not have any chest drains or anything else on, so it does not need to come down the bottom. We've confirmed all of that. Could we take the sheets off him now? And could we flatten the bed, please, to horizontal? Thank you very much. Now need a sheet on top of him. And again, this sheet needs to be wrinkle-free so it does not cause any pressure sores. If everyone is happy, the lines are all secure, could we now roll and create the Cornish pasty on each side? If everyone is happy, we will do exactly what we did when we did the proning. We are now going to roll him towards my left. Once he's in the lateral position, we switch hands. Stay in your position, but you switch to grabbing the other person's side. And then, when we're ready, we will then roll him back. I'm about to take the head ring off, and we will do that. Could you remove the head ring, please, for me? Thank you very much. Can we move him to the edge of the bed on the right-hand side? And we'll do that on slide. So ready, steady, slide. Well done. And we're going to go on roll only to the lateral position and keep him there. Ready, steady, roll. And switch hands, please. Is everyone happy and ready? We are now going to slowly just roll him onto his back. Ready, steady, roll. Well done. He's a little bit on the side of the bed, so we will move him to the middle again on slide. Ready, steady, slide. Brilliant. Let us take the top sheets off. Could you pass me one of the pillows if it's clean, and I will put it underneath his head.
And this is a really important moment to now examine the patient carefully, look for any pressure areas despite our planning, and then subsequently document all pressure areas. This will then inform any data submission, but will also inform any improvements in the padding and pressure area protection for the next period of probing.
We will now reapply all the correct monitoring. I will adjust the ventilation, and as before, call the ICU doctor or the doctor in charge of the patient for a review. Thank you very much, team.
Ultimately, once a team have utilised proning on the intensive care unit, by far and away it is the process that most staff are most scared about, but when they see how beneficial it is, they are most keen to utilise and save our patients' lives.